Fundamentals of data in healthcare. Hello, everyone. Welcome to session 2. And this is your fundamentals of data in healthcare. This is a part of our basics of healthcare AI series. And we talk about your role in healthcare AI and how can you be the human in the loop. I am Dr. Omar Khan, and I've been working in health tech, IT, and technology for over a decade now. Today, we are diving into one of the most important but often misunderstood aspects of artificial intelligence in healthcare. That is data. Now, if you yourself are a healthcare professional, a provider, then this is not just tech talk. You do this on a daily basis. This is about your clinical notes, your patient's vital signs, your hospital dashboards, all becoming the fuel of what powers healthcare systems, and that is how data is derived. Of course, we can have data from the environment, from the local events that are happening, the weather, anything else, right? But specifically, we will talk about healthcare data in this video. Before we begin, I want you to think about this. Every time that you document a patient encounter, every lab value that gets entered or generated, every radiology report that gets dictated, you are contributing to what will become training data for the next generation of healthcare AI tools. So whatever you're doing, it has a lot of importance. So let's break this down in terms that makes sense for all of us in healthcare. Just a bit about myself. I am a practicing internal medicine physician, and I've been in health tech for over a decade. I've established COVID-19 monitoring units, mobile applications, been there, done that in the healthcare field with technology. Now, why data is the lifeblood of AI? Let's start with a fundamental truth about AI. In machine learning, we talked about machine learning in the previous videos. The model learns whatever you feed it, whatever you put into it. Think of AI as a medical resident. It could be a house officer, it could be a junior doctor, whoever, right? If that resident only sees young, healthy patients during training, they're going to struggle when they encounter elderly patients with multiple comorbidities. The same principle applies to AI. If your data is messy, it is biased, it's unbalanced, your AI will be bad as well. And unlike a human resident who can adapt and learn from new experiences, an AI system basically, unfortunately, amplified the patterns and the training that you have provided it. Unless you go and spend loads of money and retrain that AI with more information. Of course, we do want to train AI with more information every so often. However, you don't want your first AI to be completely pathetic and useless. Now, let me give you a concrete medical example that illustrates this point. Imagine that you are building an AI model that predicts post-operative infections after surgeries, right? You gather data from your hospital over the past 5 years. But here's the problem. 85% of your surgical patients during these 5 years were, let's say, for example, they were young, they were relatively healthy, and they were having elective procedures. Now, you can't use this data for some sicker patients, inpatient and elderly patients. And if you now deploy this AI system, but your hospital actually serves a predominantly elderly population with multiple comorbidities, what's going to happen? The AI has learned patterns that don't apply to your actual patient population. It might actually miss infection risks that are common in elderly patients, but rare in the younger and the healthier patients. Now, this isn't a hypothetical problem. We have seen this happen in real healthcare AI deployments. And the key insights here is that AI can't fix bad data. It only amplifies it. If your training data doesn't represent your actual patient population, your AI system will perpetuate and magnify those gaps, those issues greatly. Now, this is why understanding why data is so important for healthcare professionals, that when you're documenting, make sure you're documenting properly, because that will be used in the future to train these models. You are actually the ones who understand what good, real documentation and healthcare data looks like. So I recommend that all of you, whenever you're working, that you make sure that you do a good job with documentation. Not that you don't do that already, but be extra diligent. Now, to recap this, why data is the lifeblood for AI. In AI, especially machine learning, model learns whatever you feed it. The quality of the data greatly determines the quality of your AI model, your AI output. AI models learn patterns from historical data. If that data is messy, biased, or unbalanced, so is going to be your AI. And these data quality issues compound over time in all AI systems. And we gave an example that if you are building an AI model to predict post-operative infections, and if 85% of your training data is from young, healthy adults, but your hospital sees mostly elderly patients, you are setting yourself up for clinical errors and bad recommendations by your AI model, and you will not be able to implement that, and it will not be useful for your clinical setting. Now let's talk about the two main types of data that AI systems work with in healthcare, and structured and unstructured data. Now, structured data, as the name goes, is like a well-organized filing cabinet. Everything has a place in the filing cabinet, right? Everything has a place in that filing cabinet, and it's easy to find, and you can easily find what you're looking for. In healthcare, this includes things such as vitals. They are listed, they are tabulated. You can find them appropriately in the data in the EMR. Lab values, for example, medication dosages, diagnosis codes, they are clearly structured. So once you enter a blood pressure reading, let's say of 140 by 90, that is again structured data. Now, the beauty of structured data is that it's immediately usable by AI systems. The computer knows that 140 by 90 represents systolic and a diastolic blood pressure, and it can easily compare that to a normal range or track trends over time. Now, unstructured data, on the other hand, is like a conversation. It's rich with information, but it's mostly not organized in a predictable way. This includes clinical notes, for example, discharge summaries, radiology reports, procedure notes, and even things like patient voice messages or surgical videos. These are all unstructured pieces of data. So when you write, patient appears anxious and reports feeling short of breath, this is unstructured data. It contains valuable information, of course, valuable clinical information, but the computer has to work much harder to understand what it actually means. And here is what's fascinating. Most of the richest clinical information in healthcare is unstructured data. Now, lab results might be 95% structured, but doctors' notes are about 80% unstructured. And medical imaging is almost entirely unstructured because one image is, you could say, is always much different from a different image, and it could be so many things else happening in that single image. This creates both a challenge and an opportunity. The challenge is that unstructured data is harder for AI to process. That's the challenge. The opportunity is that there's a wealth of clinical insight locked into that unstructured data that AI just beginning to tap into with these models these days. Now think about your own clinical documentation. When you write that the patient looks unwell or appears to be in distress, you are capturing clinical intuition that's incredibly valuable but difficult to quantify. Modern AI systems are getting better at understanding this type of nuanced clinical language. And now to recap so that we clearly understand this, so structured data is neatly organized like an Excel sheet. Examples: age, blood pressure, BMI, lab values, hospital length of stay, medical diagnosis, ICD-10 codes, example WBC 12.5, temperature of 101, right? Unstructured data, on the other hand, is messy, it's free text, it could be multimedia, doctor's notes, discharge summaries, radiology scans and reports, surgical videos, pathology images, patient voice messages, everything. But of course, these are all fairly important. Clinical example would include patient is febrile and looks unwell, as we discussed. But the key insight is, this is, as we discussed already, this is the richest clinical data. It is unstructured, making it challenging, but valuable for your needs, valuable for AI applications. And lab results, as we discussed, is structured. Doctor's notes is unstructured. Now I want to go over this fascinating diagram. Dear all, I hope you are doing great and that you are liking these lessons and you are enjoying and you are learning. And I did want to suggest something as an option for you. Only if you are one of those who want to have this content in a more organized manner, there is a program that I have set up that you can find in the description. It absolutely is not necessary. However, it is only for those who do thrive in an organized approach, and there just might be a few more goodies there as well. Anyways, I wanted to share this, and now back to the video. This shows us two critical insights about healthcare data evolving from 2013 till 2020. First, notice that there is a dramatic growth in the volume of data. You can see here, the volume of data here was 4.4 zettabytes. Now it's 44 zettabytes. Well, not now in 2020, and it has exponentially increased even much further. This massive blue circle represents the total size of the digital universe for healthcare. This is a tenfold increase in just 7 years. But here's what's really important for us in healthcare. Now look at the composition of all the data that is in this 44 zettabytes of data. It could be different types. It could be notes. It could be audio, video, images. It could be medical devices. It could be pumps, monitors. It could be wearables. It could be EHR data, lab results. And you can see from this note over here that up to 90% of this data is unstructured. All of this is unstructured. This means that in healthcare, we are sitting on an enormous treasure trove of clinical insights locked away in unstructured formats. Your clinical notes, radiology reports, pathology descriptions, and patient communications, they all represent the vastness and the majority of healthcare data. But until recently, we couldn't effectively analyze it at scale and actually get real information out of this. You can see over the years, useful data is also increased. Data from mobile devices is also increased. Data from embedded systems is also increased. This is exactly why understanding how AI processes unstructured data, and we're going to talk all about that, and we're going to show and demonstrate this, and we understand that this is so crucial in healthcare. Now, the biggest opportunities in healthcare in AI are in the small slice of the structured data that we talked about. It is about unlocking the clinical wisdom embedded in the massive volume of unstructured information that you and I create every single day.